What are things men and women need to do before trying to have a baby?
Absolutely. I think a really good checkup of your overall health and well-being. So if you have a chronic illness and you're taking medications for either couple, review that with your doctor to kind of make sure it's still okay, especially for women, it's okay to continue that particular medication through pregnancy. Like, for example, some blood pressure medications are safer than others. So you might want to switch before you start trying. Both men and women, I think about just trying to optimize health. I think about adding things that are positive, right? So like sleep, nutrition, exercise, stress management, and removing things that are negative. So thinking about, smoking, tobacco, marijuana, toxins like endocrine disruptors, if you want to talk about that a little bit. And then also just not a lot of alcohol. So maybe not completely eliminating it, but just thinking about how much your intake is. It shouldn't be something that we have every single day or really a lot at one time. So thinking about things that you can add to be healthy and things that you might want to decrease. For men, I'm also thinking about hot tub use and sauna use. There's not a difference in like boxers versus briefs or things like that. The evidence doesn't support that. But truly, hot tub use more than 3 times a week, sauna use more than 3 times a week can decrease sperm production. So those are some kind of big concept things that I think about.
The interesting thing about the sauna use is that I think that I've talked to another fertility specialist, a male fertility specialist, and we discussed this, and he had mentioned that likely it's the wet sauna, the steam room, that is more implicated, whereas the dry sauna, he thinks that likely there's more aeration in there, that it doesn't necessarily always affect sperm health. And we see that because if you look at Nordic populations where they use like sauna is like a way of life, right? And their fertility rates are not lower than the average fertility rate. And so I think that that's, a good sign that, if you are a really avid sauna user, that there's a chance. I don't think it's been really rigorously studied to my knowledge, but there's a chance that it's okay to use the sauna. But I would say, like, try to limit it. If it's not a huge part of your life, limiting it is certainly not going to hurt. So, yeah, what about alcohol? What is the amount of alcohol that you think is okay for someone to have during this time?
Yeah, nobody knows for sure, but in general, men process alcohol a little bit faster than women. So the recommendation is no more than 2 drinks in an evening. That's for the general population. You never really know how it's going to impact you. Alcohol really, it's pretty hard for our bodies to metabolize. It disrupts sleep. And it's just, something that I think about too is not only alcohol, but kind of what type of alcohol. So a lot of wine, especially made in the United States, really has a lot of things that are added to it, colors, a lot of chemicals, sulfites. You think about the pesticides that are on the grapes. So you might want to think about not only how much you're having, but kind of thinking about the source to kind of enjoy it every once in a while as a kind of a special occasion, but just not routine, not on a regular basis.
So, what about toxins? I think my take on toxins is there's certainly data to support endocrine disrupting chemicals affecting hormonal health, which ultimately affects fertility. However, I like to take the approach of like not fear mongering. Like there's only so much we can control in our environment. And so, what are things that are easy enough to control that people can do? Like, what are your top tips for people in terms of avoiding endocrine disrupting chemicals?
Yeah, I am right there with you. This is not something, first of all, this is not something that I learned in medical school. I had one lecture at the end of my fellowship at Stanford on BPA and egg quality and IVF. And I was like, oh, that's interesting. And then it really came from my patients asking, like, hey, is this something to really pay attention to? So when I wrote my books on miscarriage and fertility, I really did a deep dive because you feel so out of control in your fertility process. You want to take back control. And so it's something like, oh, could this be empowering to teach people about? And is there really data there? And truly there is data, but what's positive is our bodies do a great job that it's only people with the highest levels of BPA, phthalates, parabens that really have impact on miscarriage, egg quality, sperm quality. And if you make some really pretty basic choices, you can see a dramatic improvement even over a week or two. So I am right there with you, Rena. I don't want people to live in fear because you actually cannot eliminate your exposure. Microplastics are everywhere, BPA is everywhere, but you can make solid choices that can really put you in a safer category. And so big easy thing to think about is try to get plastic away from your food, because plastic and heat and food is just not a good combination. So things you could do are, not drinking out of like a plastic water bottle, but every once in a while, okay. But like the one that you're carrying around, make it glass, make it stainless steel. Try to switch your coffee into like a stainless steel mug, not drinking it in like the thing you get from the coffee shop.
Like I'm doing right now. Just to be transparent, I'm
Yeah,
also drinking my
me
McDonald's
too.
coffee this morning.
Me too. All right. So we are humans, right? So it's like, I gotcha. I know this and I'm still a human being. Heating food up like in a microwave, like use a glass container. Don't heat in plastic. Even if you get like a frozen meal, try to maybe get a little bit thawed and then heat it up the rest of the way in something that is not plastic. When you get takeout, get takeout, enjoy it. But when it comes home, kind of put it into a different container so it's not sitting in that plastic for too long. Don't use storage containers in your kitchen that are plastic. Just invest in some glass containers to store your food. Don't think about putting plastic in a dishwasher. So it's just all about that kind of like heat and plastic and food. Try to eliminate that as much as possible. I do think about products that you put on your skin. Like our skin is our biggest organ. We really, when we're thinking about toxins, it's what we ingest and we think about what we're eating. But honestly, like our skin is really kind of absorbing a lot. And women have on average, I think like 18 products, in the morning, whether it's mascara or lipstick or think about your laundry detergent. And so when you're thinking about products, don't go and like get rid of everything. But when you run out of something, just kind of look at it and be like, all right, is there a alternative with like less ingredients or like a cleaner option? Really basic. Think about fragrance free. So when you're kind of getting a laundry detergent, what is a mountain breeze supposed to smell like? Like, what is that? Like, why do we need this really strong smell that like stays on our clothes and we're inhaling it? So just get fragrance free, so plastic away from your food, fragrance free products. Think about as you're replacing things, even your cleaning products in your house, honestly, just like vinegar mixed with water in a spray bottle does an amazing job of cleaning and, getting rid of a lot of bacteria. So you don't need a lot of these really, really strong products. So that's a thought. One last thing, just because it's like something that you can really do, is honestly just take your shoes off when you get home. That's like something you could start doing today. There's so much stuff, dust and, pesticides and things like that that we're bringing in from the outside. So just a simple little thing you could start doing today.
Yes, we are a shoe-free home. It's very South Asian and Asian inspired, but I think that's really good is to take your shoes off. I will add though, the certain things about the products you buy, they are certain products which are marketed as clean do have less preservatives in them, which means that they do go bad quicker. So you do need to be thoughtful about that. And two, sometimes people will try to actually take products out of the container that they're in, but they're actually tested in those containers. So we had a chemist on who's an expert in this area. So if you're interested to learn more, check out that podcast episode. But I think there's things to be mindful of in what you buy, absolutely. But be thoughtful. Like if you're taking out the product and putting it in a glass container, you might actually be making it less stable. And so that actually might cause harm because you might get bacteria from the unstable product you're using that develops bacteria in it or whatever. So I think just being thoughtful about that too and realizing like there are preservatives in a lot of things. And some of those things are really there just to protect us from getting bacteria and other factors that can make things less shelf stable. And so if you're used to using things that have a lot of preservatives, you just have to realize like the cleaner stuff might go bad quicker and that might then cause other issues. So just things to think about. Yeah. What about things about for women? Is there anything different that you would add that you haven't said for men already or in general that you would say that women need to be doing?
One thing people often ask me about is when do I stop my contraception? Because I want to get pregnant. Do I need like a washout period from my birth control pills and things like that? Honestly, you don't. But when you stop it really depends on the birth control method that you're using. So some things take a lot longer to get out of your system and allow you to start ovulating regularly, like a Depo-Provera shot. So that's a shot of progesterone that usually lasts for like 3 months. But sometimes people won't actually ovulate until about 6 or 9 months after their last Depo shot. You want to kind of think about that. Birth control methods that you could stop right away and could ovulate in 2 weeks and get pregnant without even having a period, an IUD. and even birth control pills. Like there's a rebound effect sometimes with birth control pills, that your first ovulation after you stop your pills is actually better, or just like sometimes you even ovulate 2 eggs. I mean, I'm not saying that you can plan for that, but I'm just saying like this concept of having a washout period really doesn't hold up with kind of fertility. I think that it does make sense if you really do have a goal of like, I want to get pregnant this summer. That's in 2 to 3 months. You might want to stop your birth control pill early and use an alternative type of birth control, like a condom, just so you can start get to knowing your own body. Because people think, oh, on birth control pills, I'm getting a period, but that's really a withdrawal from the hormones. And it's not that your body's actually ovulating. Like the reason that you're not getting pregnant on birth control pills is you're not releasing an egg. And so if you stop it a couple of months early, you can see, oh, like, do I actually get a period on my own? And that is a wonderful way to figure out if you're ovulating, because you have to release an egg. And then if you're not pregnant, about 2 weeks later, you'll get a period. And so getting a monthly period, it does not have to be exactly 28 days. Less than 25% of women have a 28-day cycle. But if it's like about, 26 and then maybe 30 and like 28, that's amazing. Think about how much your body is communicating and your hormones are actually kind of coordinating and making that happen. And so doing that, trying ovulation predictor kits in the middle of the cycle, just to be like, hey, am I, learn how your body works. Like look for the signs of ovulation. Around ovulation, you've got high estrogen levels. So you're going to have thinner and like more copious cervical mucus. So you look for changes kind of in your underwear right around the time of ovulation. You have more energy, feeling a little bit more frisky around ovulation. This is all estrogen. And it's really powerful to learn about that. And then when you're ready to start trying, you're not playing catch up and learning like, oh, am I ovulating or not? And if you stop early and you figure that out and you are not ovulating, then it's good to see a doctor and figure out why. Is it a thyroid issue? Do I have PCOS that the pills were kind of masking for years? And so I think that's really empowering to kind of think about planning. And that doesn't mean that you're necessarily trying until you're ready, but it can be really, really helpful.
Are exactly regular, meaning not necessarily 28 days, but like their cycle is 30 days and the next time it's going to be 30 days. It's not going to be 31, it's going to be 29. How many people actually have that specific regularity?
Most people, I'd say like 80-85% of people have about a monthly cycle. What I worry about when there's real unpredictability, people will say, oh, I could go 2, 3, 6 months without a period. That's a warning sign. Or I never know when I'm gonna get a period. Sometimes I have bleeding twice a month and I don't know if it's my period or what's going on. That sounds like an ovulation. That sounds like irregular ovulation, and it should be checked out to figure out what's going on.
Whereas like the one day here or there is not a huge issue.
Right. So our cycle length, which is cycle day 1 is the first day of bleeding and the next cycle day 1 is the next first day of bleeding. That cycle length, which is like we always talk about 28 days, that really is dependent on when you ovulate. The most consistent part of the cycle is after ovulation. That's typically about 12 to 14 days. And the sort of lead up to when you ovulate, that can change a lot. So if someone has a 28-day cycle, they probably ovulated around day 13, 14, 15. If they have a 35-day cycle, they probably ovulated around day like 20-ish. And so that's important to figure out, because some people, their natural cycle is 32 days. And if they're following like an app that just tells them, oh, you're most fertile on cycle day 14, because the app thinks that everybody should be a 28-day cycle, they're going to miss ovulation and get pretty frustrated pretty quick. And so that's why, this is not stuff that we were taught in health class. We were taught, you're so fertile that you're going to get pregnant without even thinking about it, that, they put the fear in, and then they don't finish the rest of it. Like, oh, actually, this is like a normal, I hate the word normal, but this is like a typical, cycle. And this is typically where you ovulate. And if you want to try to conceive, your fertile window is the 6 days leading up to and including ovulation. So have intercourse about 2 or 3 times in that window, and you've got it. Like you've got that sperm exposure.
Right. So 2 or 3 days, 2 or 3 times around ovulation is sufficient, is what you're saying here.
Yes. Yes. Oh my gosh. People, have so many different recommendations on that. They read so many different things on Reddit and all these things. There's so many myths surrounding fertility. I really believe people are trying to help each other. And I think that if they had intercourse twice a day, every single day of their cycle, and they got pregnant, they're going to tell their best friend that that's what they should do. And that is just exhausting. So I think about it with physiology. I don't think about it with like, oh, my friend was successful with this method. So after ovulation, the egg is viable for 12 to 24 hours. And sperm is in the reproductive tract for up to 5 days after intercourse. And so you want to front load. So if you're figuring out that you ovulate on day 14, 15, 16, so a week before that, you'd love to have intercourse every 2 or 3 days. So a really common thing is people assuming like, I've got to wait until I've got a surefire, ovulation sign, like a ovulation predictor kit or something. And then I'm going to have intercourse. I'm going to save it up, and I'm going to like make sure, but then they might miss it because the ovulation predictor kit didn't work that month or something like that. So those like learning about your cycle is to sort of help actually decrease the stress so you can kind of optimize and not be so worried about timing it perfectly, because it just doesn't work that way.
So when we talk about men's sperm health, we tell people, okay, when you look at the data, it seems that sperm health does improve, or at least the amount of sperm you're going to get per ejaculate improves as time goes on. So the longer you abstain from sex, the more ejaculate you get. But after some period of time, usually around 5 days, you start having worse DNA damage and fragmentation. And so at that point, now you're affecting the health of the sperm. So generally what I was taught and what we tell people is try to have sex like every other day, right? Because that's going to give you sort of an optimal, a good amount of sperm per ejaculate and a likelihood of conception. It makes it easy to remember. And then, up to and through ovulation.
Yeah, we are in agreement.
Awesome. Also when people are trying to conceive, I think the other major issue is that sex becomes a chore. Right. And people are like, oh, sex used to be fun. And now it's like, hey, we got to have sex, whether we want to or not, whether there's desire there or not, we're going to have sex. So what tips do you have for couples going through that? How do they keep that sexy alive?
First of all, acknowledging it. And I acknowledge it at the very first visit. I sort of am asking history and kind of when you say you started trying, what does that mean for you? And then I say, are you able to have intercourse a couple of times in the middle of the cycle around ovulation? I never assume, because when I used to assume, people would kind of get into a treatment that they might not even need. And you have to ask the question. And sometimes people, it's usually the couples that are here and sometimes they get really shy. They're like, well, we can't. So sometimes it's on the female side, like vaginismus or pain with intercourse. Or a lot of the times, a lot of couples cannot try at home because he cannot ejaculate inside the woman. There is a lot of erectile dysfunction. There's a lot of ejaculation dysfunction that people just don't talk about. And so I really try to bring it up and not make any assumptions and validate that. Be like, hey, that's really common. I see it a lot. And I think that what we can do is really make sure that we're not missing anything. And then I also really want to make sure, can you ejaculate for a semen analysis? Is it intimacy that you can't ejaculate, but could you give me a sample? Because if someone really can't, then that really could be like a real physical medical issue. We're referring to a urologist to kind of look for diabetes, blood pressure, all the things. But a lot of times it's really psychological. It's really kind of a mental block. And so I say, listen, let's just do a checkup. Let's make sure we're not missing anything, hormonal. Let's look at egg supply. Let's look at her anatomy. Let's get a semen analysis. And then let's talk about what we could do, not only to help you get pregnant now and start your family, because that's why you came to see me, but also let's talk about long-term, like how if you want to have a sexual relationship where there's penetrative intercourse, let's figure out who we can help you see to make that happen. Whether it's for her to see a pelvic physical therapist or for him to see a sexual therapist, whatever it takes. But oftentimes, I'm talking about doing at-home insemination kits. And so it's funny. It's like, well, you're a fertility doctor. Why aren't you like having people do, IVF for that? And it's like, well, if it's really just that there has not been sperm exposure, let's do the basics. Let's make sure we're not missing anything. But I teach people about these at-home kits where he can go and ejaculate, and then he or she can collect the specimen in a syringe and just put it in the vagina. and they might actually get pregnant without me. Or we could do in the clinic, we can do intrauterine inseminations, which have a higher chance of success. But I kind of, at first, I'm offering both. So I'm so glad that you brought that up, because sometimes infertility has nothing to do with like blocked fallopian tubes or a low sperm count. It really is an inability to try at home. And a lot of people don't talk about how common this is.
If you like that clip with Dr. Lora Shahine, check out the full episode right here.